ArchWell Health next on City Corner.
I'm so excited to be here. I am Dr. Wilson, the Market Medical Director for ArchWell Health in St. Louis. Here speaking on behalf of all of our providers. We are so excited to be in your community. We are passionate about senior care, and we cannot wait to spend time with you. So we think our model is fabulous because we have time to spend with all of our members, and we also take that time to listen to you. And I think what really makes us special is that we do care. And I know that doctors are supposed to care, but we are very passionate about serving you. And that passion starts at the top of our organization with our Chief Medical Officer, Dr. Michael Lipp, who's here today. And I also want to introduce Dr. Christina Ocampo. She will be the physician here starting in January of 2022. But for now, you all are stuck with me. So if you decide to come to ArchWell Health at North Kings Highway, I will be your doctor, and I have a fabulous nurse practitioner with me, Erica Mayweather, who's from the community and loves the community too. She wasn't able to be here today, but we are very excited to have her. And please take some time to say hello to all of our providers. We have some from our other centers around the market. So just go up and say hello. They love to chat with you, and I can't wait to see all of you soon. Thank you.
Hi, I'm Sarah Thompson, and welcome to City Corner. You've just seen a clip of Dr. Janell Wilson making an introduction to ArchWell Health at one of their locations. And now you just saw footage of her on site. Now she's in studio. Thank you so much for being here. We're going to talk today about ArchWell Health, about your 4 locations here in St. Louis, and just overall about healthcare for seniors. But I've been looking at a lot of the footage, and it's really exciting. Maybe just start things off and just tell us, what is ArchWell Health?
So ArchWell Health is basically primary care for seniors. We see 65 and over, but we like to think that what we do is decrease barriers to care. So we know that in our communities, African-American communities or medically underserved areas, that there is a lack of access to care. So maybe they can't get to the doctor because of transportation, they can't get their medications, they can't see their specialist, or they can't even get in to see their primary care doctor when they need to. And so we try to take care of all of that medically, as well as other things to make sure that they have whole body care.
Okay, so there's 4 locations. This is new to St. Louis. You're new to St. Louis, so welcome.
Thank you.
And you've got a tall task in order, but let's kind of go through this. We've got these 4 locations, Ferguson, North Kings Highway, which that footage was just from, South City, and Overland. So we're gonna have some B-roll that we're gonna run with this, but just walk us through with what the centers, how they work, how they operate, how they look, they're gorgeous, how this is all supposed to function together, because it's very welcoming, I will say that, when you look at just the facility. But tell us about the different locations and how it all works together.
Well, I would love to. So we make sure that every member feels like, their care is important, because it is. We're passionate about senior care. So when they come into the center, we want them to feel like family. So they'll see a smiling face, that's our care navigator. Their medical assistant will come out to greet them, take them back to their room, take care of all of their vitals, bring in the physician. We'll spend lots of time going over all of their concerns. We talk about screening that we think is important in our senior population. And of course, we take care of any concerns that they have. From there, they get to meet with our care coordinator if they need referrals for specialists. We'll also arrange transportation for them to get to not only our visits at our centers, but to their specialists, so we can make sure that we really get them connected where they need to be. And then we call them frequently to check on them, just like we would if it was our own grandmother, grandfather, or for me, my mother or father.
Yes, no, absolutely. I mean, this hits close to home for me. My mom is an octogenarian and in great health, but I do witness how complicated it is.
Yeah.
I want to look at, when I was reading on ArchWell, an innovative healthcare company devoted to improving the lives of seniors, and there's this distinction of holistic primary healthcare.
Yes.
Tell me what that means.
So what that means is, in addition to the medical care that you expect at your doctor's office, we also have an activity center. And we want that activity center and our center in general to be a community hub. So people are welcome to come in anytime. Obviously, the members that belong to our centers, but their friends can come as well, or local church groups or community groups. And then that center will have activities like arts and crafts, exercise, anything that we think the population needs, if that's how to work, my cell phone, or how to get on the internet, or tell me more about Medicare, right? We want to make sure they have everything they need so they can live a full life, right? If it's 65, I feel like that's a new chapter in life where you get to like really experience things. It's not time for us to kind of say, hey, let's just, wind down, relax. It's time to really continue to take care of ourselves and know that we've still got a long way to go.
No, I in life in general should have that holistic approach, but it's interesting that this model, that's sort of the distinction. And I wanted you to sort of highlight this differentiation between traditional primary care models and how this is more comprehensive. I think you've just alluded a bit to that. But when I think about, your primary care physician, especially for 65 plus, it's sitting, waiting for a long time, seeing one doctor, then having to then probably go see somebody else. And it's just this like trail that you're following of healthcare when at a time in your life where it's the hardest to do that.
Yeah.
So you're doing something different though. And so you've alluded to a bit of that, but how do you what's that key point of making the distinction between the traditional model and what ArchWell is doing?
I think what you just described is that we have like a fragmented healthcare system. And so they'll see a specialist, but maybe they don't understand what the specialist said, or the specialist notes never make it back to their primary care doctor. So we want to make sure we have our pulse on all of that. We have, market network manager that works with our specialists in the area, so we make sure we have good communication. We can get our consult notes back. We can even talk to each other about our patients, which seems like something you obviously want to do, but it can be very difficult if you don't have that connection there. The main thing is that we spend a lot more time with our patients. So most people expect when they go to the doctor, they'll get 15 minutes if they're lucky. Sometimes it's less, and you feel rushed. You can't even get through what you want to talk about. For us, when you have a new patient visit, we'll have 1 hour. Any follow-up appointments would be 40 minutes. So we really take the time to make sure that we educate our members, because we all know that you need to understand what's going on with your body so that you know what you're supposed to do, right? We're not here to lecture them or tell them what they're supposed to do. It's like we work with them to do what they think is best for them. And so that's what I think really makes us different, is that extra time we spend with them and the connection that we're going to have to their specialists, so that we can make sure we have all the information they need, and it'll be more uniform.
No, and that's good to hear. I mean, I think just saying alone that you have more than 15 minutes, because it is, the healthcare industry, it's complicated. And no, that's a great point. I want to bring in this clip from the founder, ArchWell's founder and Chief Executive, Carl Whitmer. This is a clip really at the ribbon cutting that just took place at the North Kings Highway location. But I think some of the points raised really summarize a lot about what ArchWell is all about. Let's take a look.
I've tried to learn from Greg. He's really good with the microphone, so I haven't picked it all up yet. We are so happy to be here and proud to be here, proud to be part of the community. Thank all of you for coming out. It's so much appreciated, the support. Patrick's going to do some more thank yous in just a moment, but I want to be sure that we kind of spoke to the mission that we have, and that's really to empower seniors to live life to their fullest. And it's so important. So what we want to do at ArchWell Health, as many of you know at this point, we are exclusive to patients that are 65 years and older, and we work with payer partners in the Medicare Advantage, Medicare reimbursement area. And so that allows us to really engage with seniors in a very exclusive and true and a trustful way. We think it's really important to have trust in healthcare and also have access and to create access where there's a shortage of primary care. And so that's what we're about. So we couldn't be more excited about this. I do want to take a special moment, or a moment rather, to have a special thanks to all the ArchWell Health team. I'm here just really to support you. That's all I can do. This is the team around me that's in orange and blue and white that does all the real work that is out there caring for seniors. And that's what our mission and our passion's about. So I want to say a particular thanks to them. And also Dr. Wilson, Dr. Janell Wilson, who is our market medical director. She's been fantastic. So to them, a round of applause. So like I said, we really want to transform the way primary care is delivered. We want to do it close to home, and we want to do it exclusively for people 65 years and older, because it is a different type of care. We're going to take more time with patients, as Dr. Wilson mentioned. And just thanks so much for all of you being here and allowing us to be part of this day in this community, and great weather. So thank you so much. Great to see everyone.
That's a nice clip, and I saw you in the background there nodding your head, and you're in agreement. I mean, so here's where I'm going to say with this. I mean, everything is so well presented. You're really feeling the messaging here. You're listening to it. And you start to ask yourself, is this too good to be true? Healthcare just doesn't seem like it could be this easy. What do you say in response to that?
So I say in response to that is that it is easy. It shouldn't be rocket science. I think people make it much more difficult than it should be. You know, what we really want to do is keep our members out of the hospital. When they go to the ER, when they go to the emergency room and get admitted, that's when their health starts to decline. That's when things get worse. And what research has shown is that if members come and see a primary care doctor, we know everything that they have, all their conditions. We screen for certain conditions to try to catch it early and treat it before it gets worse. We have a better chance of keeping them out of the hospital. And that's really the point. We want the quality of care to be better for them, their quality of life to be better, and that's really what, you know, the Center for Medicare, Medicaid Services wants us to do. That's the best way to judiciously spend the money that we do to take care of them, is to keep them healthy and keep them out of the hospital. That's really what we want to do.
No, that's a good point. And I want to kind of dig in more to that in terms of preventative care and just even with the patient loads. We've got some details to go into. For now, I'm going to put up a couple full screen graphics so you can learn more about ArchWell. So the first one that you're going to look at up there we go. Helping seniors lead healthier, happier lives through superior holistic primary care. You can find out more information at archwellhealth.com. That's the first graphic. Then you're probably wondering, where are these St. Louis area locations? There they are, 4 locations: Ferguson, North Kings Highway, South City, and Overland. The footage that you've been looking at is coverage STL TV captured from the North Kings Highway and South City location. But for more details, head to the website, archwellhealth.com/locations. And we're going to have more with Dr. Janell Wilson. We're going to take a quick break, but we're going to be right back. So please keep it right here on STL TV.
It's not. Here, put that on it. Put that on. It takes less than 1 minute to find out if you may have prediabetes, and you can do it here. So what are you waiting for? Just go to the site.
This is the story of a boy who didn't talk for a long time. The boy liked things to always be the same. Any changes would scare and upset him. The unknown was an unfriendly place. The boy was very sensitive to lights and sounds. So he built secret hiding places where they couldn't get in. The boy didn't like looking people in the eye. He wasn't trying to be mean, it just made him feel uncomfortable. Sometimes he would flap his arms again and again.
One day, I found out I have something called autism. My family got me help. Slowly, I found my voice and learned all the ways I could live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
If you smoked, this new lung cancer screening could save your life. Visit SaveByTheScan.org.
150 over 90.
180 over 111.
160 over 110. I had a stroke.
This is what high blood pressure looks like. You might not feel its symptoms, but the results from a stroke are far from invisible or silent. If you've come off your treatment plan, get back on it, or talk with your doctor to create an exercise, diet, and medication plan that works for you. Go to loweryourhbp.org
If I would have followed a treatment plan, I would not be in this situation.
There's so many reasons to love St. Louis, you can't pick just one.
What I love about St. Louis is the 79 unique neighborhoods and 108 beautiful city parks, including Forest Park, which is actually larger than Central Park in New York, and the gorgeous Tower Grove Park right here.
And there's always something new to experience, no matter the time of day or the season. So come and experience St. Louis.
Here we go, folks. 3, 2, 1. All right, ladies and gentlemen, once again, put your hands together for ArchWell Health, our North East Highway grand opening, folks. All right.
Hi, I'm Sarah Thompson, and welcome back to City Corner. Today we're speaking with ArchWell Health, and you were just looking at footage from a very recent ribbon cutting ceremony at the North Kings Highway location. I'm joined by Dr. Janell Wilson. Thank you so much for being here. The St. Louis Market Medical Director, I should emphasize that. So you are overseeing all these 4 locations. That's a lot of work.
It's a lot of work, but I love it.
Yeah. It seems like a really great team. There seems like a lot of enthusiasm about just bringing this concept here. And this is really across the country, is that right?
Yes, we have other locations in cities, and we're just going to keep growing. So
just keep growing. No, I think there's clearly something here. I mean, and I was reading in the material about just the research that went in even to the concept of this, and there's clearly something about having compassionate care for seniors and comprehensive care for seniors. I know one thing that distinguishes ArchWell Health is also the patient load or that patient ratio. Do you want to talk a bit about that?
Sure. So when their typical primary care office, the physician could have anywhere from 3,000 to 5,000 patients in their panel. And so at ArchWell Health, we have 450 to 600 because we want to be able to have that time to spend with them. So I think that makes it really unique. So our doctors really know our patients inside and out, even our nurses, right? So we have a whole staff around us that supports us outside of the typical, care coordinator, referral person, and front desk. And MA, we have a nurse. We're going to have a registered dietitian in the market. We're going to have a licensed clinical social worker trying to help with some of that behavioral therapy. And we're going to have case managers. So when our patients go to the hospital, we can make sure that they're coming right back to see us and we can get them taken care of. So a whole team and a lot of time we get to spend with our members.
And a whole team really is needed because outside of just a diagnosis or screening and staying on top of your health is accessibility to how to maintain your health, right? So it's like a whole other side of things to stay healthy. Let's talk about outreach teams because I think this is interesting. You're really proactively going out there, wanting to be a part of the community outreach. What is an outreach team at one of your locations?
So we have several individuals at each location called membership consultants. They go out into the community and find, members that want to come and see us. And so we can do that at a community center or senior center. We set out tables in front of grocery stores. But I think what ArchWell Health did a great job of is getting ingrained in the community before the centers were even open. I mean, the buildings were just kind of shells and we were just waiting for the logo to go up, but we were already out there networking and letting people know about us. So we've got great relationships in the community. They were excited for us to come. And so you can feel that energy there when you're at like the grand opening. And that's what feels different. Like when people were there, they said it just feels different. It feels like something special. And that's how I feel every day when I'm going in to see members, because now we have our members coming into the center. And they're just so excited. And it just really warms my heart to be able to take care of them this way after hearing some of the stories, oh yeah, I'm going to see this doctor, but I don't know what it's for. And they're sending me over here to this lab or this hospital, and it's so far away, I can't get there. But this center is right down the street. I could walk here, it's a block. I heard that today. So that was awesome.
That's really great to hear, because I think what you're hinting at too is there's just this basis of trust and respect that every human being wants in their life, right? But as you age, you sort of feel that not happening as much in your life. And especially when it comes to your health, you want to feel that your doctor knows your name, that there's trust there, that there's respect there. And I think that's kind of what you're alluding to. So the model really is built to sort of nourish all of this and make this function.
Yes.
Yeah. No, this is really interesting. I want to bring up another clip that we have.
Okay.
I know you've been busy, another ribbon cutting clip, but this is another one from Carl Whitmer, the founder and chief executive. And I've pulled it in here too because it's a great summary, I think, about really what ArchWell Health is aiming to do and is doing. So we're going to take a look at that. Here we go.
I like to think of what I do as just anything I can do to support this team up here. So my first comment really goes to thank you to the entire St. Louis area ArchWell Health team. You guys are great. It's been great. It's a great day here in South City. We are also excited about our North Kings Highway location, the Overland and Ferguson. It's just been wonderful to be part of these communities and to really get involved and be engaged. Our mission is to empower seniors to live life to the fullest. And I am a huge believer in primary care. The healthcare system can be confusing, and we are exclusively providing care to people 65 years and older. And there's a reason for that. As I said, the healthcare system can be confusing, and we want to be the partner, be the medical home for our members, seniors that trust us. And it is about trust. It's about access to care. We want to provide convenient, great care close to home in communities where we can be part of that community, where we can be engaged in the community. And this team that you see here today and all the others that are in attendance, thank you for supporting us in this endeavor. It's fantastic. It's going to be a great time, and we couldn't be more excited about launching here in South City. Again, many thanks to all. It's too hard to recognize everyone that's in the room. Patrick's going to help do some of that in a moment, but it's really important. I think the other thing about this is when we talk about care for seniors and this exclusivity, if you will, not in a way that's hard to get to, but in a way that just says, hey, the care for seniors is different than the care for others. It takes more time. The center behind you has been developed and designed in such a way that it's friendly to senior citizens. It's friendly to people that need that close to home care. We have a community room here that we want to be part of the community to provide education, events, other kinds of activities where we can engage. And that's all part of being this medical home concept that we have for our members. And so thank you all so much for being here. Thanks for the team for all this great work. Thanks for the great weather that we had. You guys held off the rain. And so that's fantastic. So thanks again. I'm going to turn it over, I think, to Patrick. And is that right, Marlo? No, coming back to you? Yeah. See, she has to correct me. I have to just be up here to do what Marlo asked me to do. No, I'm kidding. But I'll turn it over to Marlo. And again, thank you all so much, and thanks to the team. And we are so much looking forward to being part of the South City community. Thank you.
All right, and so we've just seen a clip of Carl Whitmer, the founder and chief executive of ArchWell Health. So here we have this advanced model that we're talking about. We're looking at these really nice state-of-the-art facilities. And then people are probably watching this thinking, how can I access this? So what is sort of the criteria? I mean, this is seniors only, so what does that mean?
So 65 and over, Medicare Advantage plans. So if they don't have Medicare Advantage and they have regular Medicare or the red, white, and blue card, they can come in and talk to one of our membership consultants, and they can walk them through how to make the change. We'll get them on the phone with a broker to see what plan is best for them so they can join ArchWell Health as a member.
Got it. So if they are not on that, then they can come in and check to see what that. Mm-hmm. And then are you doing tours then? So so we've shown some footage and we've got our B-roll, but people to actually come step foot in, you're able to do tours. How
All
does this
four
work?
centers. They can just walk in. There's always someone there at the front desk to greet them. There's typically a membership consultant there, and they're ready to give tours, walk you through the center, introduce them to the physicians and the care team. So we're all there waiting for them.
Got it. And I mean, when you think in your career too, so you've moved here to oversee all of this in the St. Louis market, the why kind of comes into place. Like where in your, from, the why, not why is this sort of business here, but the why from your standpoint as, as a doctor and providing care, what makes this unique to you and why do this?
I think the biggest thing that makes it unique is that I feel that our executive team stands behind this vision and they're passionate about it. And so when I went to medical school and became a doctor and I thought about the people I want to help, I really love to help people that look like me, that could be my relatives. And, my mom and dad are on a Medicare Advantage plan, not here, back home, but being able to serve them, it feels right. I wake up and I'm excited. So it's not, I'm not doing this for the money or for anything. It's because I really want to help people, and I finally feel like I'm in a company where we can do that and we can actually make sure they live their life well.
No, it's really nice to hear. It's reassuring to hear. It's just a
Yeah.
lot is going on. We're living at a time where a lot is going on, and I think people really want to establish that trust. Before we leave, this is a question that I should have probably started the show with, but for somebody watching this at home, if you had your 3 tips for staying healthy, preventative care, if you're 65 and over, what would they be?
Ooh, okay, 3. So,
And you've got 30 seconds now, but what would they be?
My 3 tips are to stay active, whatever that means to them. So it doesn't matter if all you can do is some hand or arm exercises. You can take a walk around the block. You can do that. Socialize. Make sure you stay out there in the community. Have friendships, right? And our activity center can provide that as well as, exercise. But make sure that you're active. You keep your brain healthy and active. And then you want to eat well. And so that means a lot of different things to different people, and there's all types of diets, but really just make sure you're eating fruits, vegetables, lean protein as much as possible, and really want to watch the salt intake, especially if you have heart disease or anything like that. So I think those would be my big 3. And if I could
you
add
have a little bit more time. I don't want to put the pressure on you. It's like game show, and But I think too. For screenings too, it's important to stay on top of that, is it?
Yes.
And talk a bit about something that I always find we overlook a lot, but the mental health factor, especially during the pandemic, which is seniors can often be very isolated. And so, again, this hits back into something you're doing, but maybe before we wrap up, you allude to the communal standpoint you're doing. Is it events, or is it you're bringing people together?
So we're bringing people together. We'll have kind of an activity calendar every month. There'll be some standing events that will bring other people in to do talks. And then we'll even have the space open if community groups or churches want to use it for something that they're doing. So really, we want it to be the community hub, not just the doctor's office. That's why we put it in the community, so they can get there. It can be a resource to them, and they can come in and enjoy it. They can come in and have lunch with us. We just want to see them. We really love interacting with them and talking with them, and it's a lot of fun. It's a lot of fun for all of us.
Oh, it's been really good to talk to you today. No, it's very nice. It's just a breath of fresh air and just inspirational, and you're providing hope. And I think that's at a time where people really want to know that there's hope for how they're going to maintain their health. And so I appreciate you being here today. We've got the information there for you on the screen. Check it out, ArchWell Health, helping seniors lead healthier, happier lives through superior holistic primary care. You can find out more information and about the 4 locations here in St. Louis, as well as everything that they're all about at archwellhealth.com. There are the locations: Ferguson, North Kings Highway, South City, and Overland. But again, you can head to the website for more details, or you could show up and take a tour, as Dr. Wilson pointed out. All right. Well, thank you so much, Dr. Wilson.
Thank you for having
us.
me.
Thank you. Thank you at home for watching, and keep it right here on STL TV. Experience St. Louis.